Hi, I'm Natalie Michaels, editor of Tulsa Kids Magazine. We're so glad today to have Haley Riggs for PJ's Corner. This is a regular feature in Tulsa Kids Magazine, and today we're going to be talking about milk anemia. Haley Riggs is a pediatric dietitian in the Pediatric Gastroenterology Clinic for St. Francis Children's Physicians. In this role, Haley focuses on how nutrition affects digestive health in children and develops special diets for children with particular gastrointestinal needs, such as food allergies or celiac disease. She also educates families, and that's why we have her here today. She will be discussing a very interesting subject, and that is how drinking too much milk can contribute to anemia in children. Welcome, Haley.
Thank you. Thank you for having me.
Haley, can we start with just exactly what anemia is?
Sure. So it's really if your red blood cells are just not healthy enough to make hemoglobin, and your hemoglobin is kind of what helps you move oxygen to your body's tissues. And so iron deficiency anemia, you can have anemia of different nutrients, but iron specifically helps make that hemoglobin. So if you don't have enough iron, your body's not making that hemoglobin, the protein that helps move oxygen to your tissues.
Okay, I see. That makes sense.
Yeah,
Can you tell me how drinking too much cow's milk can contribute to anemia in young children?
of course. So we see this actually fairly often. And really, so nutrient deficiencies happen really two ways. You're either not getting enough in, like you're not consuming or eating enough, and then or you're not absorbing it. And not absorbing it could happen for different reasons as well. So when it comes to cow's milk, drinking a lot of cow's milk, first of all, cow's milk is not a good source of iron. So we're not really getting a lot of iron when we're drinking cow's milk, but it can be it can, like, for kiddos, it can seem like they're drinking a lot of calories, so they're not hungry for those good iron rich foods. So that it can contribute to not consuming enough iron. But then specifically with cow's milk, the calcium in cow's milk interferes with the absorption of iron. So if you're drinking, you can be eating lots of good iron foods, but then once you're drinking too much milk, it's not being absorbed because that calcium is kind of interfering with that absorption. And then another reason why maybe something's not absorbed is like inflammation. So if you're having inflammation in like your GI tract, then you can't kind of tap into those iron stores or that iron that you're eating, and so you're not absorbing it. And cow's milk can be inflammatory to your GI tract, and so it can interfere that way with iron absorption.
Hmm. It's something that I had never heard of before, so it's
Yeah.
it's really interesting to me. Is there a recommended daily intake for children for cow's milk?
Yes. So children over the age of 1, the recommendation is 24 ounces per day or less. But if we're drinking more than 24 ounces in a day, then we're, increasing our risk for that poor absorption and poor intakes and the iron deficiency.
What would the early warning signs be that a child is drinking too much cow's milk?
It's tricky because typically, it does. We see a lot of kids whose like lab numbers show iron deficiency anemia, but there's not tons and tons of signs. But a lot of times we see kids that are, excessively tired, or it can decrease your appetite, having like brittle nails, pale skin, sometimes cold hands and feet. And then in more severe cases, you can have like dizziness or shortness of breath. A
Hmm.
lot of times we act like, toddlers and young kids are supposed to be super duper active, even if we want them to be sitting down. It's good
Right.
that they're active. So a lot of times we can tell, like, if those young kiddos are not as active as they should be, we might start investigating.
Hmm. I wonder about using, I think sometimes parents don't realize I wouldn't either. drinking the milk makes you full, like you said,
Hmm.
and then you may not realize that then they're not getting enough nutrition otherwise. Is there a way to help a child realize that, or is it just about restricting the milk or providing more foods?
I think it comes down to meal structures and meal timings. I think the best recommendation I have is, well, I think it's really what's most difficult is switching those young infants, like when they turn 1, off of so many bottles. You know, they're used to getting so many bottles throughout the day, which is typical, and then transitioning them over to milk and off of their infant formulas have, or breast milk have more iron in them. So
Right.
like transitioning them over, it kind of, you have to restructure your meal. So I usually recommend milk at meal times. And for reference, like 8 ounces of milk is like a small like school carton.
Right.
So if you're doing milk at meal times, breakfast, lunch, and dinner, that's your, and if you're doing 8 ounces, that's your goal or your limit. And then we're not getting milk all day long or in between to where we're, getting calories and getting full all day long. And then we're not hungry to eat those foods. Or we're
Okay.
just drinking lots and lots of milk and we don't realize because we're just continuing to fill up our cup.
Right. Right. And
Yeah,
that can be easy to do. Can you tell me about how severe anemia can become?
sure. It can get pretty severe. And actually, so to diagnose iron deficiency anemia is just blood work. So like labs. So if anybody ever feels like their kiddo's, showing these symptoms or has concerns for it, you can ask your doctors or pediatrician to just order blood work. And that's how it's diagnosed. So it's I would say fairly simple. I mean, depending on how well your kiddo gets labs. But depending on those numbers, in severe cases, you might have to take a trip to the hospital for some IV iron and some IV blood. And usually you don't, it's not typical that they stay very, very long. I used to work over in the hospital and you would see these kiddos. And then, they're there for a couple of days just getting their numbers up, their lab numbers with iron and extra blood.
Hmm. Um, and then that treatment, does it involves changing the diet, and then are there medications involved?
Yeah, so the most severe case would be something like going to the hospital and getting IV iron and blood. But then depending on where your lab work falls, sometimes you can just start like an iron supplement, like a pill that you can take, or there's actually like liquid supplements out there that like younger kiddos can take. So sometimes you can start that and then come see like me, the dietitian, wherever, and then we kind of talk about what they're eating. And like if you come and see me and your kiddos going through a gallon of milk in 2 days, I'm like, okay, this is our first recommendation.
Mm-hmm.
And we'll kind of get our milk under 24 ounces a day. And that can really help. That in itself can really help. And that's more often the case when I've talked to some kids, is it's usually because we're just over consuming milk.
Hmm.
But then we want to make sure you're getting at least 2 servings of like iron rich foods a day. So we'll kind of talk through that of like where we can add some, or, if we're doing well and not. And ideally you would hopefully be able to, correct the milk and make sure you're eating good iron rich foods and eventually come off your iron supplement. It does kind of depend on like why we're deficient. And that's something that you could work with your doctor. They'll probably do different workups and make sure we're not like losing blood or having like a chronic inflammation to where we have to just do something else to help with the absorption.
I see. Could you tell us about what some of those good iron-rich foods would be?
Yeah, of course. So the best iron rich foods are meats and beans. And that can be tricky too for some of the younger kiddos, or like maybe some older kids that find they're just really not into meats or beans, or like their lifestyle changes and they just want to be a vegetarian or something like that in the
Right.
older kids. So it can be tricky, but like meats and beans are the best sources and the best absorbed. But you can get some iron from like eggs and like lentils, and then of course like some green leafy vegetables. And then your fortified grains. So like fortified cereals is usually meaning they have added iron, or like breads and brown rice and pasta.
Okay, that's great. Even sneaking those green leaves into a smoothie or something.
Exactly. It's for the
Yeah,
iron.
right, right. We've talked about some of these, but are there any other practical strategies that parents could use, also just to balance the milk intake with also making sure their kids have enough iron-rich foods and the calcium they need from the milk?
Yeah, really just trying to stay under the 24 ounces a day. And then like I said, just trying to make sure we have meal structure so it's not drink milk all day long. And the iron rich food, like, you can introduce like meats and beans really, really early. Like you can do that before one if they're small and like easy to chew and things like that. But really making sure when it comes to milk, paying attention to how much we're offering. And it's easier to do that when it's like at a scheduled time.
Right.
Yeah.
Do you find that parents are surprised to learn about anemia being caused from milk?
Oh, absolutely. And it can get really, like when I used to work in the hospital, it can get kind of scary because now you're in the hospital because your blood numbers are out of whack and you're nervous, but then the fix is really easy. So I think it's relieving that there's something that caused it, but it is typically something that people aren't aware of.
Right,
Yeah.
right. It was new to me.
Yeah.
Well, Haley, thank you so much for joining us. I know this will be informative to a lot of parents.
Yeah. Of course. Thanks for having me.
Thank you.
Yeah.